Okay, let's say you've always taken care of your skin, okay? You used your eye cream, you wore your sunblock. Well, congratulations, you probably look really good for your age. But what do you do if you have an age spot or some sun damage, or maybe you've got some broken blood vessels? Do you have to just live with it? Well, you don't have to if you don't want to. We went to SpaMedica, a cosmetic surgery clinic in Toronto, to find out about the latest in corrective surgery techniques, which include a leg vein treatment that's the first of its kind in Canada. Well, here you go. The first time Images has attempted a laser light show, so just watch this.
Okay, come on in, Hazel, and lie back and relax, and we can get going. Now, leg veins are a very, very common problem. Probably 600,000 to 700,000 treatments a year done for unwanted leg veins. They're a problem for women because they're a cosmetic blemish. Some of the more severe ones, the big varicose veins, can be actually symptomatic, and that's usually covered by the insurance plans of most provinces. This device is really for the deep blue veins and the very superficial veins. What I mean by deep blue is you can see this combination right here. This little constellation has a big deep blue guy here that when I compress it, it disappears, and when I let go, it comes back. And then a number of little superficial guys hanging out around the periphery. Now those will show through nylons, and if you wear shorts, they can be unattractive. And in the past, we would have had to use a needle definitely for the big blue ones. And maybe a laser might have helped with the superficial ones. This device has two treatment arms. The first arm, it looks almost like a gun, and it shoots an intense laser beam from the end of it that will close off the big blue vessels. The beautiful thing about this as well, in contrast to needle treatments or outpatient surgery, is that it's very fast. In 15 minutes you can cover large areas of the leg. The other side of this is what we use on the superficial veins. Those are the tiny little spiders. And this treatment head and the filter through which the light comes is an intense pulse light that closes off the very superficial spiders. So in one box, driven by software, we're able to set the parameters to treat the big blue ones and then the superficial little ones very quickly and very affordably. It is a laser, so we have to protect our eyes, and we have to always be concerned with safety, so everyone does wear goggles for this type of procedure. And I'll just put my glasses on. We don't need to do anything fancy to protect the skin, just some gel. And I'm going to get Terry to put some gel on. Terry, we're going to treat this big spot here. Laser technology changes very rapidly, and in this clinic, I'm fortunate that we have about 8 or 9 lasers that we can apply to any given problem, which is why the center is frequently visited by people, because you have a lot of options and we can point the right photon for the right problem. With the leg veins, the leg vein pricing varies on the amount of time you just want to spend doing it. And because it's a very fast system, we just charge by the 15 minutes, and it's $250 for 15 minutes. Now, the brown spot laser is good for sunspots, aging spots in the back of the hands, the neck, the face, unwanted moles, flat moles that don't look suspicious in their growth, and inflammatory changes in the face if you've had a pregnancy spot or a sunspot. And how it works is it's another wavelength of laser, slightly different than the one in the hair removal, but it's gated, meaning that it releases the photons for short blasts, and that means that it doesn't go deep into the machinery of the hair follicle, actually stops right at the surface of the skin, is absorbed by the pigment in your spot, and it basically creates a crust. And when the crust comes off in 2 or 3 days, half your pigmented spot's gone. And the rest of the pigment is broken up into millions of pieces that your own body's immune system removes over about 6 weeks. So with one zap of the laser, and 6 weeks later your brown spot's generally gone. The odd person needs one touch-up, but usually one treatment's enough. Most treatments fall in about $150 to $250. So it's still out of pocket for people, but it's a service that they really want. It's simple, they can go back to work, no downtime. And so a brown spot generally be around $100, $150. And then every other brown spot is paid by pulse after that. So usually a few $100 you can treat every brown spot in your body that you don't like. The demographic of the people that show up for this has changed in the last 5 years. It's really any woman between 25 and 75 are our clients. The younger ones are very outgoing, energetic professionals, self-actualizers often, and they see something they don't like and they want it taken care of as quickly, efficiently, and effectively and affordably as possible. Is it vanity? People just want to look their best, and when they look their best, they feel their best. And it's about a quality of life, and cosmetic surgery is not for everyone. Laser cosmetic treatments aren't for everyone, but for those that it works for, it really enhances their sense of confidence and vitality, and they feel good and look good.
Okay, when we come back, we're doling out those kisses to the latest and greatest stuff from the world of beauty. It's the Images Product Road Test, and it's coming up.